Okay.
Good morning, everyone, and please forgive me for the momentary technical difficulty I just experienced. I'm Mark O'Brien with the RX Abuse Leadership Initiative of Colorado, or RALI. I hope you're all continuing to stay safe and healthy, and I want to thank you for joining us today for this important discussion. Today's webinar is entitled An Innocent Path to Teen Heroin Addiction: What Parents Need to Know. And I'm honored to be joined by an esteemed panel who've worked tirelessly on prevention and education efforts around substance use disorder. First, I want to give a little bit of background about RALI and 9Health. RALI Colorado is an alliance of local, state, and national partners who are coming together around one shared purpose: addressing the opioid crisis. We believe it's vital to educate individuals and families about the realities of the opioid crisis and provide them with the resources and tools needed to prevent substance misuse. RALI Colorado is helping support several programs that span efforts at prevention, treatment, and recovery from opioid addiction. We're focused on providing tools for the safe disposal of unused and expired prescription medicines and raising awareness about the warning signs of opioid misuse. 9Health 365 has served the community for over 40 years, with a mission of advancing health awareness and providing people with the tools they need to take responsibility for their own health. In partnership with 9Health 365 and RALI, our discussion today is one way to reach into the community in Colorado with a goal to educate and inform the public about the growing imperative to reduce substance use disorders and help the community know and use the skills to spot the warning signs of addiction to prevent these negative outcomes. So as we get started, I'd like to take a moment to introduce our panelists and thank them for their time with us today and their commitment to addressing these issues. Dr. Camilla Sasson is a practicing emergency medicine physician who also serves as the special advisor to the National Veterans Health Administration Medical Advisory Panel and leads the VA's ED Opioid Safety Initiative. She continues to work clinically in the emergency department in Metro Denver and maintains appointments in the Colorado School of Public Health. Dr. Sasson is the Vice President for Science and Innovation for Emergency Cardiovascular Care at the American Heart Association. She's committed to working to decrease health disparities and to use a community-based participatory research approach to identify and implement solutions to improve the health and well-being of community members. And Amber Francis is a certified addiction specialist and registered psychotherapist. She's currently working for Southeast Health Group as an addiction counselor. She generally works with a population of individuals who are on probation, parole, or court-ordered to complete substance use disorder treatment. Her organization provides integrated community mental health services in rural Colorado. She strives to encourage awareness and cohesiveness to promote support for not only people struggling with addiction, but also those who support them, using a humanistic approach in her personal therapy style. Amber is also a member of the Partnership to End Addiction. And finally, Bill Krall was born and raised in Denver and has lived all over the country. He spent his mid-teens to early 30s addicted to a variety of substances, most significantly heroin. And thanks to the love and support of family, friends, and Mile High Workshop, he now has over 5 years of sobriety. Also, he thinks the Beatles are severely underrated. So to get us started this morning, we'd like to share a short video about Bill's experience.
So I started smoking weed and drinking a little bit in middle school and into high school, and that quickly progressed into kind of an anything and everything type of deal. I had a surgery when I was 17 and was prescribed Percocet at that time to deal with that. And once the the pain kind of went away. I remember liking that feeling that it gave me very much. When I was 22, I tried liquid Percocet for the first time and felt that I don't know, it made me comfortable with myself, and that was probably something a feeling I hadn't had in a long time. So very rapidly got really into OxyContin, and it was very widely available. It was really easy. I didn't have to go to any doctors or anything like that because just the streets were flooded with it. And after 2 or 3 years of that, that got way too expensive, and kind of only started doing heroin at that point and moved into that, and tried multiple times to get clean over the next 10 to 12 years. And I went to many rehabs, and eventually I went to Cedar over at University of Colorado Health, and they helped me very much, and found out about Mile High Workshop, and they gave me a job and a lot of life skills and some support. And now I have 5 years clean. So I had tried to get clean many times and failed, way too many to count, and had kind of run through the trust of my family and my friends and my support system, and was kind of out there as a lone wolf. And my father got very sick all of a sudden, and didn't look like he had too long, and made the choice to go into rehab while he was in the ICU in the hospital, and didn't know if he would be alive when I got out of treatment, but really felt like I wanted him to see me clean before he passed away. And we actually ended up having a good year and a half with me clean before he ended up passing. But I'd say my father getting sick was what really gave me the motivation to get clean. Communication is a big thing. If you think something's going on with your kids, talk to them about it. And those can be really tricky conversations. But I know from my parents, a big thing they did was go to Al-Anon, and which is a 12-step support group for friends and family of alcoholics and addicts. And they worked really hard to work their own program and kind of deal with what was going on with me. I think the big thing they learned there was they can't control it, they didn't cause it, but they can compound it. So really taking that approach of taking responsibility for their part, but also holding me accountable for my part, and not thinking that everything is their fault. But I think getting that outside support is really important, and keeping the lines of communication open is very important. One of the big things I had to deal with was almost a resentment towards my family and my friends, my parents specifically, along the lines of, why did you let things get this bad with me? And putting a lot of responsibility on them for my actions. And that was really, really tough to get through. And also very important, I wouldn't be sitting here today with 5 years clean without accepting responsibility for my actions, but did have to deal with that resentment of why aren't you helping me? And I think in any family, that's a really tough situation, because a lot of people don't know what to do. And I think getting that outside support, there are a ton of groups and a ton of options out there, and they're not very hard to find. But dealing with that resentment, I'd say that was a really big thing.
Wow. Thank you, Bill, for sharing that powerful message with us. And I know that while we were streaming your video, some folks may have joined us. So I just want to quickly welcome those who have joined us in the last few minutes to this webinar today, entitled "An Innocent Path to Teen Heroin Addiction: What Parents Need to Know." Now, Bill, in your video, you kind of talked about that path that started out in adolescence and sort of developed into higher levels of substance use. And it seems like, I want to talk about this just a little bit. Sometimes there's this kind of seemingly innocent or innocuous early experimentation that young people do, that it's easy for parents sometimes to kind of write off. until there's this kind of more intense shift in behavior, and a young person is swept down that path of addiction. And Amber, I wanted to start by asking you how this, if that's a common path, and kind of how that shows up in your work.
Hi, Mark. Thanks. Yeah, so actually witnessed that a lot in adolescence, and usually it seems to start with those environmental issues of like peer pressure and, hey, you know, my friends are doing it, so it must be cool. And then, you know, and then it leads into some of the behavioral issues that come into that. And those are the things that parents are easily distracted by or can miss very easily, is the simple things such as like lack of school connectiveness, which they may not even realize is going on, but can be a very big element in that. An increase in impulsivity, especially in adolescents and younger teens. That seems to be a huge thing, and the same with sensation seeking. So it starts with all of that, and those are the three biggest areas in behavioral that I would say that for parents to definitely keep an eye out. And like Bill had said in his video, the communication is vital.
Yeah, thank you so much, Amber. And Dr. Sasson, I imagine by the time this is showing up in the emergency department or other settings where you may be working, that people are oftentimes a little further down that road. But do you find that pathway is one that kind of resonates with you in the work that you do?
Absolutely. You know, I think, Amber, you hit right on the head. I think there's signs, right? And I think if you talk to a lot of parents and family and friends, especially when they bring their loved one in later on, maybe later in the course of their addiction, oftentimes they'll say, gosh, you know, I wish I had noticed when, you know, my loved one stopped going to school or stopped doing sports, or maybe started with, you know, something like cannabis, like edibles, just thinking, oh, these are innocuous, nothing, you know, this isn't really anything to worry about. It's just a little bit of, you know, whatever, drinking on the weekends with their friends. It's not that big of a deal. And I think that's where, when you get to the level of sort of coming to the emergency department, oftentimes this is when, let's say somebody, you know, Bill, like you said, was started on a medication just for like a simple issue or concern, like a fracture that happens. And so, you know, I think there's things that we as physicians and healthcare professionals now know to look for, which is that we don't prescribe long-term opioids like we used to do 5 or 10 years ago, right? Like that was standard care to give you 60, you know, Percocet after a fracture. Now we limit our prescriptions to 3 to 5 days, especially from the emergency department, because we know that the abuse potential is so high. You know, you also have to think about some of the long-term consequences as well. So, you know, for folks that are, for example, starting on illicit substances like or prescription drugs and then moving to illicit substances, you know, heroin can oftentimes be snorted or it can be injected. And so you start to see the physical manifestations of this, not just from the you know, risk of infection and those types of things from shooting, but also, let's say, just the physical addiction that happens, the changes that happen in the brain themselves from people who become addicted to substances. And so I think that's where we have a long way to go as healthcare professionals to really start seeing these signs early on and getting people into treatment. Amber, I think you hit it, you know, right on the head. We have to get folks to treatment sooner, and we have to recognize and look for these signs as healthcare professionals, but also as family and friends.
Yeah, that's a really great point. And I think I like how you kind of mentioned both that looking for early signs and not waiting until this progresses a lot, and then those brain changes. Because I think when we're talking about young people, we really are talking about a population where there's a lot more risk when substance use is occurring. The brain is still developing, and that early drug use, with whether it's drinking, marijuana, vaping, can actually lead to those structural changes in the brain that increase the likelihood of developing a substance use, you know, later down the road. In a lot of ways, young people can become addicted a lot more easily than adults. So, Bill, I know you talked about this in your video. What are some things you would suggest to parents to kind of help prevent their children from starting down this road?
It's a great question. Thanks, Mark. I think communication is the big thing. I think it's very easy, and I've even experienced this with my friends, of just kind of to not look at things and to tell yourself that everything's okay. So really, if you think something's up, talk to people about it. I know one change my parents made that was very frustrating at the time, but it ended up being really beneficial, was a trust with verification policy. So if they gave me $20 to go to the movies or something like that, I would have to bring a movie ticket, and a lot of things like that. But keeping the lines of communication open and dealing with the stigma, I think that's a big thing. I think the use is so widespread at this point that it's touched pretty much everybody's lives, whether it's them personally, parents, children's, partners, friends, family, all those things. And we still are hesitant to talk about it, I find a lot. And it is so widespread that everybody is going through it at some level. So just talking to each other, I think, is the big thing.
Thanks, Bill. How about you, Amber? What advice would you give to parents to head this off before it gets started?
You know, I have to kind of agree with Bill on that. I think that communication is huge. And a lot of these can really stem from childhood traumas, which, I mean, can seem very minimal, to adults in some cases, but in reality, they can really be the starting point of a co-occurring disorder that could lead to mental health issues that need to be addressed and need to be taken up. So, I mean, I think at the first sign of any of these things, therapy is a great thing that we can provide through the nation, through the state, and it can be done in such a variety of different ways. I mean, they have the telehealth now to make it convenient. Our agency, for example, we send therapists into the schools. We have tablets at the schools that can help address those co-occurring disorders that can help prevent. And, we offer family therapy where we can bring in the families into things to help show the family, different approaches and different warning signs, red flags, communication tactics, and that can, and hopefully in turn be a success for the building of that foundation.
Yeah, I think it's important to talk about those treatment options, because we can absolutely all work our hardest and do our best to prevent this from happening. But the reality is that it does happen. It's a part of the fabric of our culture at this time in our lives. And it's also important to remember that it's a medical issue. So we do have, when this becomes a part of something that you're concerned about for a loved one or yourself, there are options. Just like when we look at high blood pressure or diabetes or other chronic illnesses, there are ways to treat and manage this. So Dr. Sasson, I wanted to turn to you and talk a little bit about some of those therapy options, the medications that people should know are available if they are looking for care.
So Mark, I think it was such an important point that you just made. I think we don't look at a diabetic patient who comes in and says, I just ate a really big meal at Applebee's tonight and ate that piece of cake, and judge them for coming in with a glucose that's high, right? A blood glucose that's high. We say, oh gosh, you slipped up, it's okay. Here's how we're going to adjust your medications, or here's what you should do moving forward. And I think we have a long ways to go still to start thinking about substance use disorder in that same way. It's a chronic illness. It is something that, you don't just get over. Just like I don't get over diabetes, I don't just get over hypertension. It is a part of who I am. And it is an illness, a medical condition that I have to be very conscious of and be thinking about all the time. And so, I think a lot of folks think, oh, I'm just going to quit cold turkey. It's fine. Don't worry about it. Or you've got family and friends who say, well, gosh, you're weak. You don't know what you're doing. Like, I can't believe you can't just fix this on your own. What's wrong with you? There's a lot of blame, I think, and a lot of distrust that happens. And there's also a lot of misperceptions that, this is the person's like head not being able to do what they need to do. And in reality, it's a physical condition. And that's what happens when you have an addiction, is that you have a physical need for the substance to be able to provide the dopamine, to be able to give you that sense of just getting back to baseline. It's not even getting a high necessarily, it's just getting back to baseline. And so, if you start to think about all of the different substance use disorders that are out there, if we look specifically, for example, at opioid use disorder, there are medications like buprenorphine and naltrexone that can be a very important part of the, not just treatment of OUD, but also to get you into a position in which you can think clearly. And that's not substituting one drug for another. I've heard that many times. And that's not what that is. It is an ability for you to be able to control your cravings, to have a partial opioid agonist there that can help you get through some of the withdrawal symptoms and can give you the ability to get your life back. So that's one option. For example, there's methadone. There are options for people who suffer alcohol use disorder as well, in terms of medications that can be used, both short acting and long acting. I think one of the things that we also think about is that it's not just therapy, it's not just medication, it has to be together. And I think that's another piece of the puzzle too, as well, is that one thing may not necessarily work for you. You may need a multitude of many different things that can help you get there. And I think, Bill, to your point, having the support of your family and friends, having them go to Al-Anon, in addition to you doing what you need to do for your path to recovery, is so important. Because again, it's not going to be a straight path. There may be many circles, there may be many off ramps and on ramps. And it's going to be something that you deal with for the rest of your life, just like we would with diabetes and high blood pressure.
Some great points. And I think what you're saying about these other chronic illnesses is really important too, is because we do have different options, and there isn't a one size fits all approach to treating most conditions. And so, Amber, I wanted to turn to you and just ask you, like, well, how do we figure out what is the best approach for someone we're concerned about, or for ourselves, and what are some of the factors that go into that determination?
Some of the most important factors in that, I think, is, like Mila said, is cohesiveness. I think addressing it from every aspect, not just one. I mean, there are conversations that I think that for adolescents, parents can have with their primary care physicians that can bring up a multitude of different approaches, that can be from therapy, that can be from substance abuse treatment, that can be from medical perspectives. And I think it's a combination of all of these factors together and working together to meet that particular individual where they are at in terms of finding the best treatment for them. Because as you said, Mark, it's not a one size fits all. So this therapy is not going to work. This medication is not going to work for absolutely everyone. It is definitely a group effort. It is a team working together and finding the best route for those clients. And that could be in terms of inpatient care for a temporary, period of time, for medication management, withdrawal support, other kinds of lethality aspects. So, I mean, there's many different approaches, but I think the biggest thing is making sure that everybody works together and is in the same circle and on the same page with everybody.
Thanks, Amber. And Camilla and Bill, you both in different ways talked about the stigma that, in a lot of ways can get in the way of people getting healthy, whether it's a reluctance to acknowledge that there's a need for help or to seek support. And then on the other side, the way that, providers and people who are in a position to care may respond to somebody whose behavior they disagree with, and maybe without, acknowledging the biological components of this being a physical disease. And Bill, I wanted to turn to you and ask, you've seen this in your own family, how certain beliefs and getting support around how they were relating to you was helpful. And I imagine there may have also been some beliefs that were not as helpful, and you probably see this in the community too. What are some of those things, those ideas that folks have about this disease that wind up not being that helpful? And what are some of the ones that wind up being really helpful?
I think a big thing is something Amber mentioned earlier about meeting people where they are, and that control aspect. I think if someone you love is experiencing that addiction and that pain, it's real easy to be like, why don't you just get better, or try to force them into it? And that can end up really driving some significant wedges between people, and it makes the steps needed to get better really hard to obtain. So I think a big thing is people have to take care of themselves first. You can't help anybody else if your head isn't in great shape, and it is a very painful and significant thing to deal with. The other thing is, you don't give up on people, you know, and a lot of times that's easier said than done. It's probably not, you know, recovery is probably not going to happen on the first try. In my case, it probably didn't happen on the 20th try, but people stood by me. And so just that support, not giving up on people is really huge. And as far as what does work, it's kind of along the same lines, just keep trying with that. And it's very hard, at least it was very hard for me to put myself in a vulnerable position. You know, I knew I was in rough shape. It was another thing to admit that I needed help. And it was a whole nother thing to say that to somebody else, you know, even with a lot of people around me saying, hey, you're in rough shape, you need help. So just kindness, grace, and compassion when you are, I hesitate to say confronting, but I will say addressing the issue with the people around you. And I think those three things are very important to keep in mind.
Great point. And I think we could probably all use a little more kindness, grace, and compassion, no matter what we're dealing with, right? So we are getting pretty close to the end of our time. And I was trying to figure out a good order to go in to give everyone a last word. And I realized we have an A, a B, and a C first name. So we'll just do quick alphabetical order, A, B, C. Amber, do you have anything else you want to share with us before we finish up?
The only thing I would say is if you or a loved one, you have concerns about any kind of addiction, make sure that you keep that line of communication open and reach out for help, self-help groups, friends, family, professional. Do not be afraid. There's nothing wrong with your loved one. There's nothing wrong with you for saying, hey, I've hit a limit. I need some help.
Thanks, Amber. How about you, Bill?
I would like to give a big thank you to Mile High Workshop. When I just had a few days clean, they gave me a job training, and a lot of support systems, a lot of resources that, in all honesty, I don't know if I would be alive today without that help. They've changed a lot of lives, and I feel grateful to include myself as one of them. So big shout out to Mile High Workshop. Great work.
That's awesome. Thanks, Bill. And I know we can't see and hear everyone, but I'm going to suggest a quick virtual round of applause for them, because that is really awesome. And I'm glad they were there for you. And Camilla, let's finish up with you. Any last words to share with the audience?
You know, I know I'm a parent. I have a 5 and a 7-year-old. And I think it's hard for me to think about a time in which I would not support my child, or would not be able to look out for them or protect them from things happening. And I think, you know, as a parent who maybe is watching this right now, and maybe you are dealing with a loved one or a daughter or son who has had an addiction or has an addiction right now, just know that you didn't do anything wrong, and that you cannot protect them from everything. And that there are many, many factors right now, especially in the pandemic world that we're living in, that could have actually exacerbated maybe some underlying psychiatric issues like depression, anxiety, those types of things that could have been how they are coping to try to get through this very challenging time. So I always like to sort of end with the idea that, you know, we can work on this together. Addiction is not the end of the road. And that, just like Bill said, there is hope. There are resources, and there are many, many people who are here to help you, whether that's your doctor, whether that's your, you know, your therapist, whether that's your friend or your family member. We are here to help. And just remember that there is a huge opioid issue right now, but there's also stimulants and methamphetamine, which are making a huge, huge comeback right now, especially here in Colorado and across the world. And those are things that can start out as prescription drugs like Adderall, and those types of things too as well. So just want to keep that out as something for parents to think about, as well as that we have, you know, there are signs, and you may miss them initially, but ultimately know that we are all here to help you.
It's such a powerful message, and that reminder that it's about the community. This isn't a thing that we're going to solve by isolating ourselves and trying to remove ourselves from that community. That's such that relatedness that is so important for all of us. So that does bring us to the end of our time together today. I just want to thank you so much, Camilla, Bill, Amber, for sharing your time with us, but more importantly, your wisdom and your compassion, which just absolutely comes through even in this virtual setting that we find ourselves. and especially for the work that you're doing to make our communities safer, our families safer and healthier and more vibrant. And I want to thank everybody in the audience for joining us to learn more, and for caring about this really important issue. And that concludes our discussion for today. Thank you so much.